So we've talked a lot about people who are refusing vaccines, and you know, I really don't like the term anti-vaccine. I think that it's really not a very helpful term. I mean, there's a really small percentage of people that are really ideologically opposed to vaccines. It's less than 1%. It's less than 1/4%. I mean, anti-vaccine means you're ideologically opposed, and that's really not what's going on here. And I think the term is used really commonly for parents that question whether or not they should get vaccines, or choose to delay some vaccines, or choose not to get certain vaccines. But I don't think it's that for the vast majority of them, they're not ideologically opposed to vaccines, and they are committed to the health of their child. They've just come to a very different conclusion than I have, and most scientists have, and they don't believe the data, but they think they're acting in the best interests of the child. So I think when calling someone anti-vaccine, I think that's, you know, it's kind of like fighting words, you know, and it doesn't help, and it creates more polarization. So I'm going to try to push you away from using that term. While it's easy, I don't think it's, you know, occasionally maybe it's on target, but usually not. So vaccine hesitant parents, you know, some don't get any vaccines, some get vaccines but not others, and they pick and choose. Sometimes they delay when they get vaccines. And we had a question earlier about, you know, well, why not wait a little bit, or doctors recommend waiting. And the answer you got from the person who was presenting was that there's no safety advantages to waiting. And that's true, but there's also risks to waiting, right? Because when you don't vaccinate your child, that child is left susceptible. And for many diseases, it's young children that are at increased risk of morbidity and mortality if they get the diseases. So waiting can be a very high price. Now what that price is depends on the disease. I mean, if you wait a month to get a polio vaccine, given we haven't had a wild case of polio in 20 years, more than 20 years in this country, you know, the risk is probably pretty small. If you wait to get a pertussis vaccine, well, that's a real risk you're putting your child at. And I think the biggest group that I'm concerned about are those parents that will get vaccinated and do so with a lot of concerns. And there's a great study that was done by Deb Gust a while back, but it was audience segmentation research, and she looked at different types of parents and categorized them. And you have, you know, some parents that are just going to do what their doctors tell them, and they don't know what vaccines their kids are supposed to get, and they don't really care. The doctor says, get these vaccines, and they have a doctor they trust, and they do it. And those parents, despite all these issues, still aren't worried. So, you know, we're probably pretty good to go with that. But what you have is a group that would be called fence sitters. So these are parents that have concerns. They may get vaccinated, but they're uneasy. And this is the population that I'm most concerned about. So if you look at immunization coverage, and this is by antigen or by a different type of vaccine, and well, I just got off of my, I didn't mean to do that. Do you mind fixing that? Thank you. I thought I was hitting a pointer, but I wasn't. So this is, there we go. So here we see what vaccine coverage is by different vaccines. And the one drop here is due to a vaccine shortage. So this really isn't reflective of what people think. I mean, the point is, for most diseases, you have 90% vaccine coverage, right? So a really important point that Dr. Shukett made is the social norm is to vaccinate, right? It's really, really important. And I think that's a place where we need to be careful as this is being reported, because, you know, we've learned a lot about social norms and how impactful they are. Years ago, I was having lunch at CDC. I used to work there with the guy who was running the smoking program for CDC. And he said, I think we finally won the battle on smoking. And he showed me a picture, a poster they just put out, and it was two Marlboro men, and they were sitting there with the Marlboro Reds in their pocket on their horses. And, you know, it depicted like the classic cowboy American Western. And the caption was, one guy was saying to the other, man, I haven't gotten it up in years. Right? And it just took that whole Western tough guy and just, I mean, it's changing social norms, right? And once, because when I was a child, smoking was cool. And I remember being on airplanes and people smoked nonstop. And I was a child next to him and nobody thought twice, right? So the social norms have changed. And with that, so much just comes to follow, right? So we need to be really careful. And CDC is understandably concerned to be clear that the social norms is that most people do get vaccinated. And that's a really true statement, right? These data show that most convincingly. right? Overall, nationally, 9 out of 10 parents vaccinate, right? So I think that's a really important point. Here's some recent data that was done with a nationally representative sample, and it tells you, you know, that 94% say they're planning on vaccinating. The data are a bit old and I have some issues with it, but it reinforces that point that most parents are vaccinating. This is what I found most interesting in that study. Almost 8 out of 10 parents had concerns about vaccines, and this is what they were. They're not mutually exclusive, so it adds up to more than 100. So some of them are just worried about pain, right? And then I think your point about needle sticks and that picture of a baby getting vaccinated is a really good one. I've seen a picture where it shows the baby getting vaccinated and the baby's fine, but dad's like, you know, because it's kind of works for him. But, you know, so these, you know, and some of these things are legitimate concerns, right? Needle sticks hurt. I don't like needles. My children didn't like needles when they were babies. Vaccines may cause fevers, right? That's a true statement. Some vaccines do cause fevers. But, you know, overall, it still shows that a lot of parents are really worried. And some of these are really serious concerns, like how many vaccines at once or in the first 2 years of life, right? 1 out of 3 parents are worried about that. And if they delay, then they're leaving their kids vulnerable. Ingredients about vaccines, not tested enough for safety, you know, other chronic diseases. So, you know, you have a lot of parents out there that they're still vaccinating, but they're doing so with concerns, and that makes them susceptible to kind of falling off the edge. And if we're not careful, we could see more and more parents. So to me, this is the most striking part of this study. If you look at, and Dr. Shook had presented what she called zero-dose kids, right? So these are kids that get no vaccines. So you figure if they've gotten no vaccine, that's an active choice of their parents. That's also someone who's just saying categorically no. I'm not going to pick and choose, no vaccines, I'm not going to get them. And you compare them to kids that are under-vaccinated. And historically, under-vaccinated kids tend to be minority, lower income, you know, the things that we associate with lots of poor health outcomes, although a lot of those disparities in immunization coverage have been improved. But kids that don't get vaccinated tend to be white, higher income, higher educated, and large families. So this would be, you know, I think there was a comment about natural food stores, you know, but it kind of falls that topography. There was a recent study, you know, let me go back for a minute and talk about this slide of coverage, right? What's hard is understanding this 10%, okay? The people that aren't being vaccinated. And often we measure coverage primarily at 2 times. We measure it at preschool, children 19 to 35 months, and this is the National Immunization Survey data. It's a random digit phone survey. The records come from docs, and it captures under-vaccination among young children. And coverage overall is high. But what it usually can't do is tell you why kids aren't vaccinated. And some of it are health system issues, it's access. And even if the vaccine is free, getting the child to the doctor may not be free. Or taking a day off of work for the appointment may not be free. So there's lots of health system issues that still play a role, and that's compared to people that choose not to vaccinate. By school entrance, usually you know the difference, because they either have to get vaccinated or they have an exemption, right? So it's a clear decision. There was a recent study that was done by Tracy Liu. These are using California Kaiser data, and she looked at the different ways of characterizing these young children, and she called the under-immunized, and this is a full series. So this is 4 doses of one vaccine and 3 to another. So that's a pretty complete series of vaccines. I'd have to look it up to tell you what all those are, but it's what most kids get. And she's found an increase over time, and this is among preschool children. And then she looked at shot limiters. So these were parents that had their child fully immunized by 3 years of age, but never got more than 2 vaccines in a day. And so they presume that that wasn't just by chance, because that's actually really hard to do. It takes a lot of effort to get your child fully vaccinated and not get more than 2 shots at a time, which is what you're supposed to do, right? And she found that the rates here are increasing. So this starts to get at that issue of preschool children and separating kids that are intentionally unvaccinated or under-vaccinated versus kids that aren't getting it because of competing priorities or healthcare system issues. You've seen this map of exemptions to the school laws. I don't think I need to go into this more, but some studies we've done looked at how easy or hard it is to get an exemption. And what we found was that states that offer a philosophical exemptions or states that had easy exemptions had 50% more pertussis. So this shows that the state policy is associated with the rates of pertussis in that state. And we'll talk more about this in a few minutes. Looking at the exemption rates over time, and these data are just a little bit old, we see that the rate of exemptions overall has increased. We see that the rates among states that offer philosophical versus religious exemptions are higher, but they're increasing in both groups, right? Whenever you're looking at data and you see things go up and down a little bit, that's just variability because the numbers are a little bit small, so don't overread these things. You want to look at trends. When looking at states by how easy the processes are, and there's huge variability. So I live in Maryland, right? If I want to get my child into school, I get an immunization card. I take it to my pediatrician. My pediatrician pulls my child's medical record, fills out when vaccines were given for my child, charges me $20. I take that card to school, my child's registered. Or on that card, there's a statement that says immunizations are contrary to my religious beliefs. And I check that box, I never leave the school building, my child is exempt. Now it's called religious because it says religious beliefs. If it would have said philosophical beliefs, that would be a philosophical exemption, right? But it's really, really, really easy to get. And maybe some parents would think, oh, I don't want to vaccinate, but it's not for religious reasons, so I can't check that box. But nobody checks it, right? Or nobody checks why someone checked the box. If you don't want it, you check the box, right? So what we also found was these states that had very easy rates, again, have higher rates. They're increasing. And states that had difficult processes, the rates have really stayed quite constant.
What's an example of a difficult one?
Some states may require annual renewal. Some states might require notarizations. Some states say if you want an exemption, you got to write it out, the reasons yourself. You can't just download it from the internet or check a form. So there's all sorts of different requirements. More recently, states have been requiring educational counseling. So you have to talk to a doctor or someone from the health department, which makes a lot of sense, quite frankly, because you know, in many states and many schools, a parent walks in and says, I want to claim an exemption, and hands the form to the school nurse. And the school nurse says, oh, thank you very much, and puts it on a desk, and that's it. And it's a huge missed opportunity for risk communication. So by having that parent talk to a doctor, a pediatrician, or someone in the health department, at least you can try to make sure that they're informed as to the decision that they're making. And we'll talk about this. So the data I've shown you show that if you have easy exemptions, you have more exemptions, you have increasing rates of exemptions, and you have more pertussis. And some states have been making their exemptions more difficult. Oregon, California, Washington, and Vermont are 4 states that had very easy exemptions. They had a lot of exemptions, and they had a lot of pertussis. And to try to make things better, they added administrative requirements like requiring annual renewal or physician's counseling. Please, go ahead.
Have you broken out the religious exemptions among states that don't have philosophical exemptions? I mean, is that where the religious exemptions are increasing, where people have no other way to game the system other than to claim religious?
Yeah, so I yes, no, and yes. I agree completely that most religions are not opposed to vaccines. There's a great paper by John Grabenstein that's published in Vaccines, and he goes through all the different major religions and their views on vaccines and comes to the same conclusion you did, which is, you know, most religions are not opposed to vaccines. We did a survey in states that we asked parents who had exemptions. In 2 of those states, Missouri and Massachusetts, only offered religious but not philosophical exemptions. So these are parents that had religious exemptions. And among other things, we asked them why they didn't vaccinate their children. And they had a long list of reasons they could give, and they could write in more reasons, and only 10% even mentioned religion. So clearly the majority are using these for non-religious reasons. But they don't have a lot of choice, right? That's what's offered to them. So people have made the comments before about this clustering of exemptions, and it's a really important issue. I'll often say that refusal is like politics. It's all a local issue. So this is a state of the map of Washington State where the exemption rate is about 6% in the state, right? But there are places in Washington State where as much as 40% of parents have exemptions. This map doesn't actually have the numbers, and it categorizes over 20. But if you live here, it doesn't really matter what the state rate is. It doesn't matter what the national rate is, right? The risk to your child might be quite high because 1 in 3 children your child comes into contact with isn't vaccinated. And this raises risk to the community. So you need to be really careful when you look at national data and when you look at state data. They give you a sense overall, how is our nation doing, right? What are the norms in society? How is the healthcare system working? But they may not be great in predicting outbreaks of disease. You heard about the 89 through 91 measles resurgence. And when those cases started popping up, public health officials were surprised because they're like, well, why do we see measles? Our coverage is really quite good. And when they started looking at the outbreaks in major cities, Los Angeles, Detroit, Philadelphia, they found that these were communities that had a lot of immigrant populations where coverage was really low. So even though coverage at the state level was great, in those cities, in those clusters, you had very low coverage. And it resulted in tens of thousands of cases of measles. And we're seeing a similar phenomena here in that we're having the clustering of unvaccinated children. And what measles does, because it's so infectious, like you heard about, is it finds those weaknesses. It's not that they're not vaccinated because they're poor immigrant kids that don't have access to health care. They're not vaccinated because their parents may not want them to be vaccinated. But the disease doesn't really care why they're not vaccinated. The point is they're not immune. So if I don't vaccinate my child, right, my child's at greater risk of disease, which is why we vaccinate, right? That's pretty self-evident. But if I don't vaccinate my child and your child comes into contact with my child, then maybe my child poses risk to your child. Maybe your child can't be vaccinated. Maybe your child is too young to be vaccinated. With measles, that's an issue. Or maybe the vaccine's not 100% effective and you think your child's protected, but they're not. And we've looked at this community risk. Here's a study we did. This is in Michigan State using school-level exemption data. And in yellow, you see exemption clusters. And in red, you see pertussis clusters. And we found that if you lived in an exemption cluster, you were 3 times as likely to live in a pertussis cluster, right? So this gets at that level of community risk. We did a similar study. This was one of our doctoral students. And you know, we've heard a lot about the resurgence of pertussis, and it's largely been attributed to waning immunity of the vaccines. And part of the story with the whole injury compensation program was the switch to an acellular, safer pertussis vaccine. But it turns out, we find out a couple decades later, that over time the effectiveness of that vaccine wanes. And there's really compelling data. I mean, I think the science is very clear. That's a big part of why we're seeing more pertussis. But we thought about this and we're like, you know, we know, like in California, there are these communities where a lot of parents don't vaccinate. And we know that they're contribute to disease. It's hard to imagine pertussis is circulating and these refusers aren't playing a role. And sure enough, when we looked, they were. We found that these pertussis clusters in California were contributing to the pertussis resurgence. And I'm sure if we replicated this in other states, we'd find the same things. So why are parents vaccine hesitant? You know, one of the points that I want to make was made earlier. This is not a new issue. As long as there's been vaccines, this goes back to Jenner's time. And if you look closely, these people are turning into cows, right? So this picture's been around a lot. It's almost been overused, but people have udders growing out of them. And so as long as we've had vaccines, we've had people that have been opposed to vaccines. I think part of it is this presumption that because one thing happens after another, there must be a causal relationship, right? And we can predict that lots of things will be coincidentally related. With H1N1 in the 2009 pandemic, I worked for the government then, and my job was to run our vaccine safety systems. And this is what I was most afraid of, because if you vaccinate everyone today, every bad thing that happens tomorrow happened a day after the vaccine, right? And just by chance alone, there's going to be all these relationships. And we know that in epidemiology, things cluster. Things don't happen random. Like we think that random things don't look random, right? We know this really well with rare disease epidemiology. With cancer, you'll see a cluster of cancers, and people go, wow, there was 3 of those really rare cancers in my small town, and they're looking for like the power lines and the water sources, and when they do all these examinations, often we find it's just a chance cluster. And this is going to happen. So knowing this, for example, with H1N1, we published a paper in The Lancet where we just took background rates of all these different diseases from all these different countries and put it out there really for the consumption of the media, so that when this happens, when we start to vaccinate a lot of people quickly and there's all these chance associations, we could kind of say, look at this paper which was published before we started vaccinating to show that there are background rates of disease. And these things will be coincidentally associated. But it's really hard to get over this, you know? I have a sister that has some handicaps, and she's now the parent of 2 children. And my mom, who's in her golden years, is still wondering, trying to figure out why her daughter had those handicaps. I mean, it's just human nature. You want to understand the cause of things that impacted your life. And as long as vaccines are out there, they're going to be, you know, attributed to it. And the shore of science is to figure out, is it real or is it coincidental? And we shouldn't presume either off the bat. We should know there's going to be coincidental events, and then we need to figure out, is it chance alone, or could there possibly be a cause by the vaccine? You know, part of this also is how we perceive risks. And this comes from risk perception, and science is a risk perception. And these things that are seen as more risky tends to cut across cultures, and, you know, whether it be American or European or African, you know, we find things that are involuntary to be more risky, right? Vaccines, of course, have an involuntary nature because they're mandatory. We like individual control. If you ask people, are you better than the average driver? Like 80% of people say yes, right? Which they can't be by definition, you know? But because you drive and you think you're a better driver, you're willing to accept those rather substantial risks of driving. Errors of commission versus errors of omission. You know, somehow it's better if my child gets sick from a disease versus getting sick from a vaccine that I gave my child. Right? We have a preference towards errors of omission. I think the child just doesn't want to get sick, right? And doesn't really care whose fault it is. Natural versus man-made risks, right? We heard about measles parties. Predictable versus unpredictable, dreaded. You know, I have a friend that was terrified to get on an airplane. And I tried talking with her about, you know, the risk of driving to the airport is actually higher than the risk of being on a plane. But it was out of her control, and if it happens, it's catastrophic. She said, well, if I get into a car accident, I might just break my arm. But if I get into a plane accident, I'm going to die. And then familiar versus exotic. So I think this all just goes into how we process risk. And unfortunately for vaccines, we lose in like every category. And we have to accept that because that's the way it is. This is a pretty complicated figure, and let me just walk you through this because it actually explains a lot, right? So here we have incidence or rates, and here we have maturity and time, right? When we have no vaccine, we have a lot of disease, right? I wish I had a pointer for this. So as coverage goes up, disease goes down, right? And you saw those data. That's why we vaccinate. Well, as coverage goes up and disease goes down, you hit a point right around here. As you have coverage, you have more adverse events, right? Something bad that was related to the vaccine. No vaccine, no adverse events. More vaccines, more adverse events. Well, then you're at a point where there may actually be more adverse events than there are cases of disease. And then focus shifts. Focus shifts from fear of diseases to fear of vaccines. And the result can be a drop in coverage and resurgence of disease. Perhaps the good side, maybe we'll see, the question you asked, is now that there's more disease, do we shift focus again? Which this measles outbreak would suggest maybe we do, in which case coverage comes back up and disease goes back down. Right? So this is kind of a basic framework, which I think is quite telling. One of the challenges, we assume, for example, with smallpox, once we eradicate it, that we stop vaccinating. Well, that may not always be the case. If you take measles, even if we were to eradicate measles, because of the threat of bioterrorism, we might have to vaccinate for measles forever. And if that's the case, where does this model leave us? I mean, imagine a situation in 50 years where nobody has seen measles, but every kid has to get the vaccine. It's a very challenging situation. If you look at the rates of disease today, and these are your more common vaccine preventable diseases, and we're comparing the rates in 2014 to the annual rates in the last century, and we see smallpox eradicated, polio eliminated, 99 to 100% reduction in most vaccine preventable diseases. Go ahead.
Can we talk about mumps a little bit? I wrote a
Sure.
story a couple weeks ago.
Okay.
I know Merck is facing a couple lawsuits about it, just saying that they exaggerated the effectiveness of it. I know it wanes over time.
Mhm.
And that, you know, of the MMR vaccine, the mumps portion is really the least effective, I guess, is, you know, just has a lower percent effectiveness rate. Do you have any comments on the mumps
Well, I think
portion?
that's pretty good. Last year it was lower. Part of this has been issues of vaccine refusal. I'm not familiar with these lawsuits, so I don't really want to comment on them.
Former researchers at Merck are
Okay.
attesting that the company exaggerated the effectiveness of the mumps vaccine. And I spoke to Dr. Paul Oppett at Children's Hospital of Philadelphia, and he says his son actually goes to my alma mater, but at the University of Richmond they had a small outbreak, and he recommends, okay, if you see those outbreaks happening, that's when you should get the vaccine again, even if you've already had two, just
Right.
because the cluster, it just wanes over about a decade, he said.
Yeah, so I'm sure Paul's giving you good advice.
Okay.
I don't
just wondering
know
if you have
this.
on
I don't
this
know
one.
enough about those lawsuits to comment.
Okay.
And you know, we have done a very good job controlling mumps overall. So mumps has been one of those diseases like measles and pertussis where vaccine refusal has started to play a role. And we'll see how much that grows. You know, the million-dollar question is, will we stamp out this measles outbreak? In which case, all of these stories, while perhaps useful, none of this is that unusual, as long as we can stop it, as long as it doesn't continue. If it continues, which I think is unlikely, I think there's a really good chance that it might go on a bit longer and then it stops. And as long as that's the case, it's a same story that's been going on for some time. If we're not able to stop it and we've lost the indigenous control of measles, that would be terrible. Let's hope we're not at that point. So here I've added another line, which is reported adverse events. So these are reported to that VAERS system I told you about. So don't take this to mean that those are all real. Somebody thought they were, I guess, or they wouldn't have reported it. But here we see the rates are about the same, right? So we're very much in this place now, right about here, for a lot of diseases. And it's an uneasy place for us to be. We looked at why parents were claiming exemptions. So these were parents that have actively refused. They've taken an exemption to a school requirement. And we found that they perceived their children to be less susceptible to the diseases to be less severe. They perceived the vaccines to be less effective and less safe. They had less trust in healthcare providers. They had less trust in government. The biggest issue, though, was vaccine safety. When you asked them, why did you get an exemption, 7 out of 10 talked about safety. So it's a combination of these factors, but I think safety is the biggest issue. Other issues, trust in corporations and government is low. And this gets into that whole pharmaceutical industrial complex thing. And I think it can be on its face a compelling argument. When I first got onto this 20-some years ago and I started reading the concerns of parents, and what I found most compelling was, wouldn't you love to make a widget that the government made everyone buy? And that sounded to me like really compelling because, yeah, I probably would. That sounds like a great business model. But we got into before some of the issues about profits and opportunity costs. And the truth is, for a pharmaceutical company, vaccines historically have not been a big moneymaker. Although the more recent ones actually have brought in much better profits by the companies. Growing interest in natural products. Jenny McCarthy, when I was at HHS, led a march to the Hubert Humphrey building that said, "Green our vaccines." And I'm like, that sounds great. I have no idea what it means. I really don't. But like, I buy green, cleaning products for my house, and we're trying to become a culture that's more careful about the toxins that we expose our children to. So I think it's very, very catchy. There's a changing medical model. And you'll see some of this by the age of the physicians and how they handle these issues. But you know, it used to be that everyone went to the doctor and the doctor told you what to do and you said, yes, sir, and you did it. And now we're getting into a shared decision making, which I think has lots of advantages. There's many really, really good things about that. But it also means that parents come in having done their research on the internet with questions, and they want to be a part of the decision making process. And the model of doing what you're told is changing quickly. You know, the internet, it's amazing how quickly information and misinformation can spread. You know, and you have the American Academy of Pediatrics and the American Academy of Family Physicians and then the American Association of Physicians and Surgeons. And all three have really good internet sites where they profess to represent the medical community and their professional association. And two of them represent the vast majority of clinicians, and the other one is a fringe group that has a little store in a strip mall in Arizona, but you know, the average parent may not be able to tell the difference. And I'm going to talk a little bit about the role of the media. And you know, it's perhaps a little rude for me to come here in front of the media and suggest that it's part of the problem, but I think it has been. Please go ahead.
Yeah, I can't help but think of parents who are just really busy, don't get around to all their medical appointments, maybe, you know, single moms. Is there any evidence that it might just be they might be delaying and saying, okay, I'm just going to do an exemption for now and we'll get to this when we can.
Mm-hmm.
Do you have any data on that?
Yeah,
I just would think that would be more common than someone who is aggressively against vaccination.
It's a good question, and it's hard to study. I mean, we found that when it's harder to get an exemption, less people get them. So maybe that's weeding out the people that are just taking the path of least resistance, and it may well be. By the time your child enters school, probably your child has been to the pediatrician a whole bunch of times, right? So the opportunity to vaccinate that child should have been there many, many, many times. I think that's some of what's going on at school entry. I don't think it's a lot of what's going on. I think that may explain a lot the child that's behind the schedule, that's 2 and not fully vaccinated, that's 3 and not fully vaccinated. But by 5, probably most kids have had the opportunity. So I think that's a piece of it. You know, I'm a scientist and I like to argue with data, and it's really hard to study what you're asking. So I'm giving you my gestalt without a lot of data, which I think is generally a dangerous thing to do. Please.
Yes, the question is, even as the compliance rate is between 80 and 90%, what kind of innovation is happening in the realm of vaccines, or is there, or do you think there should be any innovation in terms of the ingredients or in terms of the delivery, even if not for this country, for producing products for other countries where there may be varying, doctors' visits aren't the same as they are here where you have a sterile environment?
So I think there's lots of room for innovation, especially for diseases that don't yet have vaccines, and especially in countries, lower income countries, where historically the needs of the first world have been what have been met by vaccines, because that's who pays for them. You know, there's been an effort over time to put more vaccines into one combined shot, and the thinking was parents don't like all these shots, so if we can combine them, that it may make parents feel better. And in one case, it didn't work out well. For example, the MMR vaccine, Merck makes an MMR vaccine, and they make a varicella vaccine. And they thought, well, let's combine them. And then we can protect against 4 diseases in one shot instead of 2 shots. And a couple things happened. Firstly, it was harder than they thought. When you added the varicella component, you weren't getting as good of an immune response, and they had to have more varicella antigen in the combined vaccine. It also increased the rate of febrile seizures. Now, MMR vaccine causes febrile seizures at a very low rate. They're generally felt to be not of long-term consequence for the health of the child, but they're scary. And I had a daughter that had a febrile seizure. I had read the studies that said the long-term prognosis is fine, but watching my young daughter seize is really scary. So it's a scary thing for parents. And when you combined them together, you had higher rates of febrile seizures. So in that case, it didn't work out so good. And in general, it's hard to combine vaccines. We're seeing more combined products. Will this help? Maybe. You know, the question is, are the parents counting the number of shots, or are they counting the number of diseases being prevented? And if it's the number of shots, this may help. if it's the number of diseases prevented, then it doesn't really help a whole lot, you know?
Okay, how about other methods of delivery? I mean, most of us, and by now we realize you either have to man up or woman up to take the shot, but what about like oral administration?
Edible patches. I mean, my kids prefer the nasal flu vaccine because it's not a shot. So there are alternative methods, and that may help. I mean, you know, there's a distinction here, and I would really urge you to think about this. There's a distinction between what science says and what the evidence says versus how parents or people feel. And they're different sometimes, you know? And so the question I would ask is, well, is there really a better safety profile? Right? Because I want science, I want evidence. But maybe for the person getting the vaccine or the parent, it just feels better and it's less of a worry. So, so we'll see. I'd like to see the evidence. There's lots of alternative approaches being considered, and we'll see what happens.
Do you think manufacturers are having the incentive to continue to try to innovate, and or since it's not any money, you're saying that they don't make money off vaccines? And
Yeah,
so no incentive?
so I didn't say they don't make money off
I'm
vaccines.
sorry, I should rephrase it.
They don't make as much
they
money
don't-
as they make on other things.
drugs are more profitable.
And the newer
than
vaccines, there's actually some good profits there.
Okay.
If you look at HPV vaccine, it's, you know, $90 to $125 a dose for 3 doses. You know, there's some profits there. Historically, the MMR, the DTP, you know, there's less profits there. I think a lot of the innovation is coming out of biotech companies and smaller companies. I'm sure that some of the larger companies are looking into it, but if you already have a product that has a really good safety profile that's been used for hundreds of millions of people, it's been studied really well, you know, would you invest in a new route of administration? I don't know if that's the best use of your investment dollars. You know, and don't get me wrong, I want vaccine companies to make money. I don't want them to make money at the expense of children getting vaccinated. I don't want the price to prohibit vaccination, but if they don't make money, they're going to go out of business, or the vaccine division is going to have no influence within the company, and they're not going to put money into developing new vaccines. So I want there to be a vibrant pharmaceutical industry making new vaccines, not because I own stock in them, because I don't, and not because I'm making a capitalistic argument. My argument is very pragmatic. I want new vaccines for new diseases. I want multiple manufacturers so we don't have all our eggs in one basket. So I want it to be a vibrant industry. I thought a couple of questions. Go ahead.
I've asked. Oh, well, my employer offers the flu shot every year, and I'm wondering why schools don't have that availability. Is there some kind of?
So some do. My children get vaccinated in school.
Oh,
I get a
really?
note every year and it says, "Can we vaccinate your child?"
Oh.
And I say yes, and they do, and it makes my life easier because I don't
Yeah.
have to go to the doctor. The general challenge has been this: that who's going to bill for the vaccines? Schools don't typically bill insurance companies, right? So who's going to pay for the vaccine? Even if you have the nurse administer it, the vaccine costs money. So the question is who bills for it, and you know who's going to pay for that vaccine. And there's been some models. CDC has funded some pilot projects where like a third party, you know, medical company like a skilled nursing group will come in who has experience billing insurance companies, because it's quite complex. It's not easy to do.
Right.
If the state wants to buy the vaccine, then it's much more
Then
easy
they're
to
paying
do.
for it.
Countries like the UK, where the country buys all the vaccine, they do a great job of vaccinating in schools. But they don't have the issue of billing because the vaccine's paid for.
Got it.
And
Please.
following up to what you're saying, I actually wanted to ask in regards to the comparison with Latin America. That was one of the things that I noticed that in Latin America, most schools provide, you know, vaccination for different types of, you know, infectious disease.
Mhm.
Can you compare more or less what, you know, what the situation is in terms of what you just described? And what's the percentage of schools here in the U.S. that are allowing children to have the vaccines? It's a
I have no
private
idea, but
public.
it's pretty small, I think. I know there were some demonstration projects funded by CDC. I know my kids have for the last few years. I don't know the data on the proportion nationally. I think it's pretty small. And I think it's hard for our healthcare system to do it this way. I don't think this is I think one of the disadvantages of having the type of healthcare system that we have. Please.
For your comment, I propose one more thing on your list of other contemporary issues. The growing belief that everything that goes wrong has a cause, and that the could have been prevented.
Yeah, I think that's true. I agree. I think there's also a risk-adverse nature. People become more and more risk-adverse, you know. I had a mother that was not vaccinating her child, and she was worried about these 1 in a million risks. And I said, you know, God, I have 6 kids. If I was worried about that level of risk, that everything my children were exposed to, I could not imagine. And she goes, oh my God, I only have 1, and it's so hard. I go crazy trying to figure out what foods to get and what cleaners to get. And she really was worried about these 1.5 million risks. And I you know, I don't have data again to show this over time, but I think as a culture we're becoming more and more risk adverse. You know. Go ahead.
Following on that, are there a lot of other things that measured either by money or illness that are more serious than vaccination? I mean, we talked earlier today about antibiotics and the growing problem of resistance. A hell of a lot more people are dying every year from antibiotic-resistant disease microbes than are dying from all the diseases that can be protected, that are being protected by vaccines. What else would you say that's the right way to look at it? I mean, a comparative importance. Or
no, because I think so the problem with that is we're our victims of our own success. By effectively controlling disease, vaccines are no longer important. And because if you make that comparison, that's where you end. But you know, I think that's a really hazardous way to look at it, because unless if you've eradicated these diseases, that's fine, right? Smallpox, I agree, don't have to worry about it anymore. But for the rest of these, if we become, complacent, they're going to come back. So, and this is part of the problem. I had Walt Orenstein present in my class last week. Walt ran CDC's immunization program for the 20 years. He was Ann's predecessor. And he had a great slide where he showed measles over time, and then he showed his budget over time. And it was like the exact opposite, right? Disease goes up, budget goes up. Disease goes down, budget goes down. And it was like the same for 20 years. And this is a very short-sighted way.
Isn't that rational?
Well,
I mean, if you're dealing in economics of scarce resources, you ought to put your money and your effort into the things that are currently the biggest problems, or is that just...
I think it's very short-sighted. That might be a good allocation of resources for today, but in the long run, you're making terrible financial decisions, right? Because some things take a long-term investment.
You might be making terrible.
Well, I can predict with almost absolute certainty, and there's few things in life that I'll do that with, but if we stop vaccinating people, these diseases will come back. And if we stop putting money into vaccines, coverage will drop noticeably, and we'll have a resurgence of disease. So if we want to just be running behind, it's like that whack-a-mole game, right? Where you just keep hitting the head of the gopher and the other one pops up. I think that's a terrible way to spend money and a terrible way to prioritize things. I mean, it's true, you hit a lot of things on the head, and you can enjoy that moment where it goes down, but I think it's very inefficient, which I think is why you're asking me this question.
Right.
But no, it's very true. So, I want to talk a little bit about the difference between media and science. And, this is really interesting for me, and a lot of why I wanted to come here for the day was just to kind of better understand how you guys do this. And I do a ton of media interviews. These last few weeks, I've had a hard time getting the rest of my work done. But, we focus on things different. I've heard many people talk about the anecdote, right? You guys tell a story. You tell a story from the perspective of an individual. And it's really, really, really compelling. And right now, the story that you guys are telling, and I'm using you very broadly to speak of journalists and the media broadly, I think is helpful to the public's health, because it's making people aware of the risks of these diseases and that the vaccines are overall very safe. And I think probably everyone now knows that the scientific community says vaccines don't cause autism. But that story is really different. Let me tell you what the story used to look like. And I've seen every major outlet do this. And I've turned down interviews because I've gotten so frustrated with it. And I've tried to correct it. But the story goes like this. Meet Johnny. Johnny was a healthy, happy little baby. Johnny's grandmother goes, God, he was so sweet. He used to look me in the eye and put his arms around me. And he was growing up so well. And then mommy says, and Johnny got 7 shots for 12 diseases in a 2-month period and started banging his head against the wall. And then you look at Johnny in the corner, and Johnny's banging his head against the wall. And then it goes back to mom, and mom says, you know, I had a great job, but I had to give it up because I got to care for Johnny. And now we're behind on our mortgage, and I can't give him the help I need. And then it cuts to somebody with a PhD behind his name who says this crazy whackpot theory that how Johnny could have gotten autism from the vaccines. And then it goes to a public health person who says the evidence favors rejection of a causal association between vaccines and autism, which is the scientific way of talking about the weight of evidence. And then it goes back to mom. And mom says, you know, I know it was the vaccine. You got to trust moms. Moms know these things, right? That story was run by every major news outlet for a decade. Maybe it wasn't autism every time. It was some other terrible disease of infancy that we don't understand the etiology. But that story was run again and again and again and again. And it was really powerful. And it took a toll. It did. You know, we tend to dismiss the anecdote for data. And we would say that plural of anecdote are not data because they have to be collected in a systematic way and you have to be scrutinizing of them. We talk a lot about the limitations of our studies. I've written papers where the limitations section is bigger than the results section because I want to tell you about all the limitations and how careful you have to be in interpreting with caution, which is why when the Institute of Medicine looks at all the evidence, they don't say vaccines don't cause autism. They say the evidence favors rejection of a causal relationship between vaccines and autism, right? But then the mom and Jenny McCarthy says vaccines cause autism. And they highlight the one story, whereas we're providing scientific papers. In many ways, we're terrible communicators, right? We're communicating different things for different audiences. And I think, you know, this idea of false balance, you know, having, you know, when I complained to the paper that ran the story that I told you, the 1st, 2nd, 5th, and 10th, and they were like, oh, it was balanced. We had both sides of the issue. And, you know, there's a problem with that because the person who said the evidence favors rejection represents like 99.9% of the medical scientific community. And the person that comes up with this theory represents, so to say it's balanced, I mean, if we didn't know the shape of the earth, right, and you had one person say it's round and one person say it's flat, and they argued about it, and then the reader or the listener would say, well, maybe it's round and maybe it's flat, right? And we have this human nature to think the truth lays in the middle, right? And when there's smoke, there must be fire. But it's not. The world's round, right? It just is. So I think this is really part of the problem. And I don't mean to, I don't know what the answer is to this. Go ahead.
I do have a question, though. I mean, okay, so the report came out about 17 years ago, but after that happened, there were several studies to, first of all, it wasn't only discredited, but there were several studies done also to make sure, yes, this does not cause autism. I mean, when all this was occurring, I personally have not reported a story like that. I don't even interview anti-vaccination people. It's kind of, I also don't think anti-vaxxers are the cause for this big outbreak. They might be a small portion of it, but I think that's giving them too much credit. I mean, was there a time though in which all this was happening, in which we still weren't 100% sure? Because I know that we... With
the autism?
Yeah.
Yeah, sure. In fact, I'll put blame. It's the nice thing about being in academia, right? I can be very candid in my comments and blame everyone, including myself sometimes, right? So are we off the record now, or are we on the record?
We're on the record.
We're on the record. So I think there's lots of blame to go around. Look at when the first paper was published on vaccines and autism, and how long after the Wakefield paper. It took a few years. And the first U.S. paper took a little bit longer. And now I'll be the first to tell you, it's hard to do good science. And you don't want to do quick, bad science because it's not interpretable. Could we have done more faster to give answers? Yeah, I think we could have. At the time when you spoke to the GI docs, because that's what Wakefield was, and he had this theory of persistent measles infection, to them it didn't make a lot of sense. So it wasn't like the biological mechanism that he described was terribly compelling. And we anticipated it would happen by chance alone. So studies were done. Could they have been done faster? Yeah, I think they could have been. Could we have done more studies more quickly and had overwhelming evidence sooner? Yeah, I think we could have, and I think it might have made a difference. So I mean, what can we do, right? Safety science is a really important issue. Look at the publications of the papers refuting or finding no association and the dates on those papers, and look at how long it took to build that evidentiary base. And the question is, could we have done it sooner and faster, and would it have had an impact? And I suspect we could have, and it would have.
Yeah, I mean, I think my question was more, did the media have some, authority to kind of report that sort of story when we were lacking evidence that vaccines do not cause autism?
Yeah, and Andrew Wakefield was really good at it. If you read the actual paper that he published, he doesn't say, I've shown that vaccines cause autism. But when he did a press release, when it was published, he went way beyond what his study said or could have said. When he was on 60 Minutes, I got a call from my mom, who's got a PhD in community health, who said, Dan, I think you should think about splitting up these 3 antigens, because he's making some really compelling arguments. I mean, Andrew Wakefield was a very compelling character. And yeah, I think the media has a really important role here. I think you should ask us, how come we didn't do studies sooner to show that hypothesis wasn't true? That's a great question. I think you should ask Congress why it's not funding these things better, why they're only responding to emergencies. Why didn't they fund Ebola vaccine research and development 10 years before they did, 10 years ago? How come CDC's vaccine safety budget is $20 million and their immunization program budget is $4 billion? 20 million, 4 billion. Big difference. Now, they'll tell you other work is done at HHS in vaccine safety. FDA does stuff. NIH does stuff. They do, right? But I think you guys can ask the tough questions, and you can put pressure to create positive change. I think there's a lot of really good stuff you guys can do.
Can I just add something? I think it's important to remember that in the Wakefield controversy, one of the things that came out much, much later is the fact that he was taking money from companies that were profiting from, forget exactly how that worked. But there was a question, where was the press, in England primarily, when this was going on, to be digging up that relationship? Why did that take so long? And I look at it especially in light of a story that I'm sure most of you saw in yesterday's New York Times, breaking the news that one of the primary climate science deniers, it's now been made clear that much of his research was in fact directly funded by energy companies. I read that story and I said, where have we been? Because the story came out, not because some journalist unearthed it, but because Greenpeace did a public records request because some of his studies were connected to the Smithsonian Institution, Harvard Smithsonian Institution. So they were public records. And now we know that that financial relationship existed. Same thing with Wakefield, and I just think it's something we should be thinking about all the time, looking for those financial relationships, which are not proof in themselves, but certainly are suggestive.
It's a great point. I asked David Salisbury.
Go deep enough into that story, you find out that a lot of that was well known before Greenpeace got the further confirmation. That's a further confirmation of old news story, which I'm not against. I think that's a good thing. Right.
So the question is, if we knew that, why are we still quoting this guy? And he was being quoted all over the place for years. Recently, he's invited to conferences on climate science. So, I think the press has a responsibility to know what we're about, know that stuff, and put it out there. Again, avoiding this sort of false balance.
So I asked David Salisbury about this. David ran the immunization program in the UK for 25 years. And he said, you kind of have to understand the British media. He said, how many American newspapers, national papers are there? Right? There's USA Today, there's like the New York Times, maybe a few, maybe. Right? And the US is a much bigger country. He's like, in England, we have a whole bunch of them. And we're one small country, and they're all competing for national attention. So everybody wants the most sensational storyline. And that's how he described this. Every day, the other paper was coming out with the more sensational line. So he said, you Americans complain about this, but we Brits really have a much bigger problem. It's a little bit different from your point. The conflict of interest was also somewhat of a British issue, because in the UK, when you file a class action lawsuit, the state will pay for fees to build that case. And that's how Wakefield got his early money, was somebody had started to file a class action suit and then hired Wakefield, who then produced data to support it. So it's a somewhat unique to Britain. I think your point is really well taken, though, about conflicts of interest. You know, I think the real question, because it's easy for me to come here and point fingers, and I'm sure you guys can complain about us scientists because we're slow to provide data and we don't speak very succinctly and we caveat everything we say. But I think that really we should be on the same page in terms of what we want, and the question is how can we work together more effectively, and how can we find ways of impacting public policy and asking the right questions and the tough questions, and that's not always easy to do.
Did anything ever happen to the editor or the sub-editors at Lancet for that matter, the peer reviewers who passed the Wakefield paper?
I don't think so. Not to my knowledge. I mean, I think the peer reviewers are anonymous. I have no idea. I don't think anybody knows who they are. I think, you know, the Lancet's actually, I think, a for-profit journal. So, you know, and they did retract it, which is an incredibly uncommon thing for a journal to do. And it's a tough issue, right? Because if you look, for example, take another example, narcolepsy following an adjuvanted flu vaccine in Europe, where there were early reports that the vaccine was associated with narcolepsy. And people were quick to dismiss the scientists and dismiss the association. And the evidence has mounted that there's probably a genetic subgroup of people who, with that particular vaccine, which is not used in the United States, that it may well cause narcolepsy. And you don't want there to be a situation where discovery is thwarted because you're going to be, you know, you don't want to publish it, and I don't want to publish it because we're all going to get destroyed along the way because it calls into question a public health intervention. That needs to be avoided. You know, I bring up scientific opportunities, and this perhaps is my own bias. I think we can do a lot more in science, partly because there's new opportunities. We have electronic medical records. We have large databases. For H1N1 in 2009, we had the most comprehensive safety monitoring program ever. And few people knew much about it. But we had, I don't know, something like, doing my math quickly, maybe 1/6 of the US population being watched on a regular basis for medical outcomes anonymously, right? There was complete privacy. But I had data every week telling me the number of events happening in these people and comparing them to the number of people that you would expect it. So if there was a problem, we would have known about it really, really, really quickly. We had an independent group of experts called the Vaccine Safety Risk Assessment Working Group. They went through super squeaky conflicts of interest criteria. I mean, they went through the ringer. I had my attorneys look at all their financial records, and they looked at all the data every 2 weeks. And once a month, they had public reports, and none of you probably heard about it, which is probably a good thing. The system was set up to be really sensitive because you want to detect any problems. But that means you're going to have false positives, right? That's just the way it was set up, and that's the way you want it to be set up. So we knew there were going to be false positives, and we knew that it was going to then go to these experts that were then going to make public reports. And early on, we found weak signals for ITP and Bell's palsy and Guillain-Barré syndrome after the vaccine. And you guys probably don't even really know. Even though it was run a little bit. I mean, it was open to the public. There were calls. And after really rigorous studies, the ITB and the Bell's palsy turned out to be false alarms. And the Guillain-Barré syndrome was probably real at a rate of about 1 to 3 cases per million. So there's an example of where we had tons of safety data, and we had independent reviews, and it was made public. It was transparent. And you know what? People didn't freak out when there were false alarms. And if there would have been a problem, we were really well situated to handle it in a responsible way. And the old way of doing business would have been the government says we looked at the data and the vaccine is safe. And people don't trust the government that much. That might not have worked. That happened with autism, and it didn't help. Right? In this model, it would have been Marie McCormick, professor at Harvard, who's never gotten any money from any vaccine company or anybody to do anything with vaccines. Her and her group of experts, who are all squeaky clean, looked at all the data. And Marie McCormick would have said, I've looked at all the data. I think we're good to go. So I think there are approaches we could take. We need to give providers more tools. 10 years ago, we submitted a proposal to NIH that would develop educational interventions for pregnant women. Because I think pregnant women are the way to go. I really do. Because that's especially first-time pregnant moms. Once you've had your second child, you know, your parenting is somewhat established. When you were pregnant, you think about, you know, how do I make the world a better place? It's the, quote, teachable moment. So we suggested developing an educational intervention for pregnant women on vaccines and then putting it through a clinical trial so we would actually know if it worked. And the NIH study section, which is a bunch of scientists, said, well, that's not really an important issue. Vaccines, vaccine hesitance, it's not worth the money. And they weren't interested. We submitted that a year ago and we got a 3% score. So it was better than 97% of the proposals. I wish it was done 10 years ago. But we need interventions that have been shown to work. It's not enough to say, here's an educational intervention that should work. We need to do studies to see if they work, because they don't always work, because that's what science does. And just like we don't say, well, here's a vaccine that should work, let's give it to everybody. We have a candidate vaccine, and we do a randomized controlled trial, and then we use it when we know that it's effective. Other suggestions I put out here. You know, there's a lot of discussion about eliminating non-medical exemptions. Right now, I think both Oregon and Washington State have bills pending that would get rid of non-medical exemptions. So for 20 years, I've advocated making them more restrictive. You heard Dr. Schuchat say, we, the federal government, thinks they should be more restrictive. I've provided you data. Our group has been doing these studies for 2 decades. I think making them more restrictive, I think making sure the path of least resistance doesn't lead to an exemption is a great idea. I think getting rid of them altogether could be really dangerous, and I think it really risks public backlash, and I would be really cautious before doing that. I think it could very well do more harm than good. So I do have concerns about that approach. I say change how the media reports on vaccines. You know, it's easy to call for change. I don't know exactly what that change would look like. I do have concerns that while today's story may be helpful in raising public awareness, I worry about what tomorrow's story is going to look like. And maybe just to end with what was going to be an earlier slide, but you know, this quote from Jonathan Swift, you know, 300 years ago, and then recent data, 1/3 of Americans reject the idea of evolution. I mean, that's really remarkable. Now maybe there's religion and ideology that makes that idea of evolution hard to believe, but there's an awful lot of evidence showing that. 40% of Americans say there's no solid evidence for global warming. I mean, you raise that issue. It's amazing to me. Now, I'm not a global warming scientist, but my understanding is the evidence is in. The jury has been, there's no question that global warming is real. And 1/3 of Americans still believe that vaccines cause autism. Right? I mean, think about when our President Bush was reelected, and about 1/2 of Americans believed and reported at the time that Iraq had something to do with 9/11 and had weapons of mass destruction. I mean, at that point, the evidence was really clear. But I think sometimes if people say things enough times, and there must, you know, if there's fire, there must be smoke. So I'll end there. I'm happy to take any questions.
I mean,
if people
are
have.
those really in the same categories though? Because not vaccinating is really harmful to the public. Does it matter that someone just chooses not to believe in evolution?
Well,
I mean, is that harmful to?
well, let's
in
take
any way?
let's take this one as an example, right?
Yeah, I mean that I see, but the evolution one.
Yeah, I guess it depends. I
I'm
guess it
kinda like,
depends on how that
whatever.
impacts child's education.
Yeah.
Right? If you say that my child shouldn't learn about evolution and Darwinism in school because it conflicts with your religious beliefs, and you know, this is not my area of expertise, so I'm cautious here.
Yes,
but my understanding is that there are schools that have prohibited books and education on evolution because it conflicted with the religious beliefs of the majority of that town. So if it impacts what my children learn, and my children don't learn what the science says, then I think it is a problem.
It's just, I don't know, there's so much about, as a reporter sometimes I feel a little frustrated because there's so much about science that changes all the time. Look at the new nutritional guidelines. They're different than they were 5 years ago.
Mm-hmm.
Eggs are in now, you know, cholesterol is not as bad as we thought. So it can be a little bit sometimes of a game of like, okay, well this is what our current findings say now, but then, you you know, a few years
And that's-
later, we're reporting a different
When the facts
story.
change, you change your opinion.
Well, that's the thing. It's just,
And that's what a good scientist should be doing. A good scientist should not be speaking in absolute terms.
Uh-huh.
A good scientist should be saying, well, this is what my data tell me, and here are the limitations of the data, and here are the conclusions I can draw on those data, but there's some things I can't say because it's possible new information will come forward. There's times when things are really settled, but even sometimes really settled science turns out not to be right. So I think you should be asking questions and skeptical. And I'm not saying that the media shouldn't report on science. I think they need to. But somehow we have to communicate better, because
Yeah.
I need to stick to what I do as a scientist and keep those caveats. Yet if I'm being put next to Jenny McCarthy, who says, vaccines cause autism, I know it, look at my son. And I say, well, the evidence favors rejection of an association. I'm losing that argument, even though the science is on my side, right?
Yeah.
So
If you were blonder.
I know I never could have been in Playboy.
No, but I guess what I'm saying though is that because we know that in science things get updated and different findings happen, it's hard not to give attention to. I mean, I like I said, I haven't written about that particular issue, but it's hard not to give attention to the littler things, just because they could end up getting bigger.
And we're
you
a
know, there could be more
and we're a
evidence.
democracy, right? We believe in freedom
Yeah.
of speech. We believe in minority views, and I believe in those things wholeheartedly. And I spent 5 years responsible for the nation's vaccine safety system, so I spent a lot of time worrying about a lot of things that people shouldn't have to worry about, because that was my job, right? So I mean, so that's fine. I'm not saying we shouldn't consider those minority voices, and we shouldn't be open to the possibility that science and beliefs and knowledge changes, because it does. I guess part of the question is, how do we tell the story? And when it's about, you know, selling, I struggle with giving interviews. I do it. I didn't do it when I was in the government much at all.
Yeah.
But I feel like sometimes myself and the reporter have different goals. And I'm not speaking to any individual here, but my goal is to accurately inform the public and to improve the public's health. And that's why I do it. But a lot of times the reporter, part of their goals, and we all have multiple goals and competing priorities and all that, but they're trying to sell their medium. And the way you sell your median is by being controversial and sensational. And to tell a story that says, well, guess what? We've only had 10 measles cases this year, just like every other year. I mean, who's going to buy that paper? Is that going to be on the front page? I mean, so I get it, but I think there's sometimes different or competing priorities.
I just want to say, in defense of the media, most of us aren't here just to give a microphone to a celebrity. You know, our goal also is to inform the public. Our goal is to provide the information so the reader can make his or her own decision about, you know, whatever issue is, you know.
Oh, I know that's true.
So
And I'm not questioning
I just-
anybody's
right,
motives.
Right.
And
The goal is to understand the scientific point of view, but also to bring in the other voices, other competing voices that may have a comment, and then, you know, the reader is going to decide, okay, you know, parse through this information. I don't think we're salesmen of, you know, information or trying to be sensational. I mean, I can understand from the researcher's point of view, you may think that because you know, you spend 10 years doing research on, you know, this one particular thing, and so you know you have all the information about it. Whereas a journalist who, you know, journalism has had its challenges. You know, we've had cutbacks in, you know, science teams for various reasons, you know, the past, you know, maybe decade. But generally, I think most journalists are about trying to get the story and also to bring in the other voices. We're not trying to be a mouthpiece for a celebrity or for a research organization.
I know that's all true. And I think your job is incredibly hard. And I think the move away from science reporters I mean, that's my understanding, is the trend that there's less and less of them. I mean, I'm a scientist. I couldn't imagine if you said, Dan, you have 48 hours to write a story on cardiovascular disease. I mean, I would say I can't do it, because I can't, and I have a PhD. Exactly. Yeah, I mean, it's such a hard thing to do, even for somebody that has a PhD in science, just not that type of science, right? And so I think even a science reporter gets given incredibly difficult tasks. And then if you're not a science reporter, which my understanding is a lot of the media outlets don't have science, I think it's really, really hard. And we're not so pure either. I mean, I need to write grants, and I need to get them funded, so I can say, just as you can, that my goal is public good. But I have financial needs as well. If I don't bring in grants, I don't have a job, right? So it's all really complex.
But I agree
So
that
I
there are reporters
wanna-
that are sensationalizing. I mean, even when I
Hank-
turn on the TV, I get very frustrated sometimes. I'm sitting there thinking they're not even telling the truth. You know, they're
Right.
exaggerating to such a level that. So I can definitely see the frustration. I know the public is frustrated too.
I just want to take
Yeah.
for a minute the points that you guys made and open this up a little bit to other journalists in the room to suggest this. You're saying absolutely accurately, science changes. And we, as journalists, don't know where those changes are going to take it. So we want to make sure we don't block out some fact or some theory that may end up being a fact 10 years down the road, right? And you're saying we want to have all voices in the story. We want to incorporate voices. But I do think, and other journalists can chime in here, that there are ways to present that story where you can include a voice, you can include a perspective, but if you know that 99.9% of scientists at this moment find a particular voice to be non-authoritative, don't open with their anecdote. Don't let most of the story be about them with a little voice at the end saying, but most scientists don't believe this. I'm exaggerating for effect. But you get my drift. As journalists, there are ways for us to present news so that it reflects the current balance of thinking. I think you wanted to say something to that?
I'm not quite on that point, but I just see in this slide a reason for optimism. If 33% of American parents believe that vaccination causes autism, but 90% of American parents actually get their kids vaccinated, there's room for optimism.
There we go.
Who cares what they think as long as they do the right thing?
Well, you're saying
That's a
that
pragmatic
facetiously, but there's a
perspective.
large part of the medical and public health community that feels exactly as you do. And they say, you know what, we don't really have to worry about this issue of vaccine hesitancy because in the end, 90% are doing what we need them to do anyway. And I think that there's truth to that. In the end, it's that decision which will impact disease, at least in the short term. My concern is that they may be doing it now, but they may not continue to do it. And when I see data that shows a third of parents are really worried about the safety of vaccines, I think those parents are put in a dilemma because they may see the value of vaccinating, but they're doing so with legitimate, well, I don't want to say legitimate from a scientific standpoint, but in their mind, a legitimate concern. So I think that the level of concern, even if their behavior is what we want, even if they're still compliant, I still worry about it. I'd be more worried about it if 33% weren't vaccinated, right? But I think your point's well taken.
The other side of it, which had nothing to do with anything other than a naive faith in science, is that the belief that vaccination can cause autism will go away when some brilliant researcher finds out what actually does cause at least some of it.
Yeah.
I mean, people are working on it. You're going to get answers.
Yeah,
You're going to get other answers besides the one that's been discredited.
But it's the plural, like you're saying, because I think autism is probably autisms. It's a whole bunch of different diseases that are being grouped. And I'm not an autism expert, but they look similar, but their causes are different. So we're not going to find a cause. We're probably going to find dozens of causes.
Richard Nixon declared war on cancer and promised it would be defeated by the end of the 1970s.
Right.
But we didn't stop just because he was wrong politically and economically and scientifically. Doesn't mean we stopped funding cancer research.
Right. No, that's true. And there's like cancers, autism is probably many different diseases that may look similar in a clinical way, but are caused by different. So it's the causes of cancers, right, and the causes of autisms.
Right.
And eventually, I guess we'll be able to explain it, and then vaccines will finally be vindicated.
Any other questions before we wrap up? Going once? All right. Well, thank you very much. Thank you, sir. Appreciate your being here. This was great. Thank thank all of you for being here. I'm so glad that you were, and I think everybody had great contributions to make. I hope that you'll look at the website, watch for other programs we have coming up. A couple of things I'll mention. There was some discussion today of risk and how people perceive risk. And there's an excellent webinar on our website that you can find if you search programs and then risk, that helps to explain how people perceive risk and why we think certain things are so frightening and other things which really are much riskier we don't find so frightening. And it's really interesting. The other is that...
Maybe why don't we push the URL to the store?
Yeah, great idea. We'll send a link out to you guys, so if you're interested in looking at that, you can easily get to it. And there's a possibility that coming up next month, we will be doing a web interview with Lori Garrett, who was mentioned earlier today. I'm forgetting the context, but she, of course, has written a book about emerging diseases in the world, and it's a fascinating read, and she's a great interview. And when that comes up, we'll have it on the website, and I hope that you'll take a look and think about listening to that web interview. It's really great. So again, thank you so much, and we are adjourned.
Thank you to the National Press Foundation. This is an excellent public service. We appreciate it.
Thank you so much.
Yes, you do.